Hi, so September is Chiari malformation month, and I want to talk to you about a Chiari malformation. It's at the base of the skull, right back here, often, and it's where a small portion has come out a little bit. It's the only way to explain it. Essentially, it's pushing onto your spinal cord, so you can have some seriously difficult symptoms, and it's symptoms that you wouldn't necessarily know or make sense of. Things like restlessness, intolerance to things, pain, a lot of headaches, but not necessarily just in the head, also neck pain. You'd also get anxiety, fatigue, migraines, muscle weakness, hand tremors. A really big one is hand tremors. People would start thinking they may have MS, or they'd think they've got Parkinson's or things like that, maybe even epilepsy, and what they need is an MRI. They can also get a lot of vomiting, acid reflux and burning. They can get numbness in their hands, odd sensations in their shoulders, kind of feel like they've got a hangover that's permanent. They get some stomach pains and they just feel wrong. And when they go to the doctors will often say, well, anxiety and depression and low mood, and they won't look that little bit deeper because it isn't giving you the symptoms of a brain tumour, so they're not going to give you that MRI. And then unfortunately you end up with something else, you end up with the MRI and wham bam, there's that Chiari. Now you're registered for surgery and you have to go and have surgery. And that's good because the surgery will take care of a lot of the symptoms, but patients have found that even after surgery, sometimes there's some scarring left there and they still have some mild symptoms, peripheral neuropathy, some headaches, some migraines, some sensitivities to light and smell, and sometimes some speech and cognitive issues, sometimes some behavioural issues. Acupuncture can help with it. Now, obviously, we can't cure that Chiari. Surgery is what does that. But while you're waiting for your surgery, and if you have any ongoing symptoms after your surgery, that is exactly what the acupuncture treats. So if you have Chiari malformation, consider some acupuncture for maintenance before and after surgery. And if you are considering odd symptoms, ask for an MRI. And if the doctors say no, ask them to put in writing why they say no. This has been Thoughts with Points. Take care out there.